Hi, this is Dr. Viral Parekh once again from Calcutta Academy of Radiology. Here is the case of the week. This is case number 19. Here is a 60-year-old male patient complaining of pain abdomen, was advised CT scan and was incidentally found to have a lesion in left lobe of liver. So this is the first known enhanced CT scan image, and what we can see from this image that there is a well-defined hyperdense lesion which is very heterogeneous in character with slightly hyperdense areas within. Rest of the visualized liver is normal. Visualized stomach and spleen also appear normal. Visualized lung fields also appear normal. This is another non-enhanced image. What we can see that almost similar findings are there which we saw in the previous slide. This is the contrast enhanced image. What we can see, there is heterogeneous enhancement within the lesion and rest of the findings are unremarkable. So what are the differential diagnoses? It could be hepatocellular carcinoma, it could be hemangioma, it could be lipoma, it could be focal fatty infiltration, it could be metastasis, and it could be hepatic angiomyolipoma. So what is the final diagnosis? So what is the final diagnosis? The final diagnosis is hepatic angiomyolipoma. If we see the images again, what we can see here is that there is a very well defined lesion which contains fat. These hypodense areas represent fat. So the diagnosis, the differential diagnosis boils down to either lipoma or an angiomyolipoma. In a pure lipoma, you don't see in areas which are slightly hyperdense, and we don't see such heterogeneous enhancement unless and until it is liposarcoma. So the commonest diagnosis which comes to mind is angiomyolipoma. We have seen multiple angiomyolipomas in kidneys. So these are similar lesions in liver, which is a very rare condition, very unusual condition, but we do find such lesions. So what are the imaging findings? As we have seen that there is a well-defined mass with heterogeneous character due to presence of fat and soft tissue. It might be predominantly low density mass. On arterial phase it shows significance enhancement. In portal phase it becomes hypoattenuated. It may be classified histologically according to the amount of fat content into several subtypes like mixed lipomatous, myomatous and angiomatous. It becomes lipomatous when there is more than 70% fat, and it becomes myomatous when there is less than 10% of fat. So that's all for today. Thanks a lot for your kind attention. Take care.